I have to start with our disclaimer. So the material that I'm presenting today was created using the most current CMS regulations. As you know, if you've spent any amount of time working with the Medicare program, those rules and regulations do change often. And I did create the material, but I'll also be answering any questions based off of that current material. So I encourage you to continue monitoring CMS and WPS websites just to make sure that you're staying up to date on the most current rules and regulations. Photographing, screenshotting, and recording of this education for profit-making purposes is prohibited by CMS. As I mentioned moments ago, I started a recording of this session. So that means we already will have a recording available to you. So barring any technical challenges with the recording of today's session will be made available to you on our WPSGHA YouTube channel as an encore presentation. You'll also be able to access that through our encore presentation link on our live event or on our training page of our WPSGHA website, so that you'll have it available to you if you want to see something again, if you had a question about a piece of information that we covered, or if you know anyone who was not able to attend but might find this information useful. It's available to them. On our agenda today, as I said, we're focusing on the CMS 855A application. We are going to talk about what the 855A is used for. We're going to talk about when you need to use that. When should it be completed? When should it be sent in? We're going to talk about how to access the forms, both paper and electronic, as well as submitting the forms. So one thing I want to make everyone aware of is as I go through this, I'm going to be showing you screenshots from our provider enrollment chain and ownership system, along with screenshots of our paper CMS 855A to show you that comparison to get you comfortable with completing this form both electronically and via paper. I'll start with an overview of what's the 855A. One of the pre-submitted questions that I received during the registration process from this group was wanting to better understand the difference between the CMS 855A and a CMS 855B. If you've ever compared the two side by side, you will notice a lot of similarities. And that is because both the 855A and the 855B are designed for business entities. The difference is that the 855B is for providers that are going to be billing for professional services to the Part B side of the program. They're going to be receiving PTAN, so you're thinking examples there would include a group, you might have a lab, you might have an ambulance service that's not tied to, it's not facility owned. Those are going to be providers that are filling out the 855B. What we're focused on today is the CMS 855A, and that is going to be for institutional providers. More oftentimes than not, it's going to be some type of inpatient facility, but it can be outpatient facilities as well. And examples of that are going to be hospitals. It can be an acute care hospital. It can be a critical access hospital. It could be a federally qualified health center, FQHC. We'll also see it for rehab centers, skilled nursing facilities. These are providers that are going to be billing using either the UB04 or the 837I electronic claim. So they're going to be submitting their claims into FIS and possibly using the DDE program, the direct data entry program. That's going to be the biggest difference. It is possible they're still getting paid for professional charges, but because of the type of facility that they are, they need to complete their information on a CMS 855A. CMS 855A applications, because they're institutional providers, they do have a slightly different enrollment process. The MACs will review and make an enrollment determination on the application. However, there are going to be some instances, typically this happens a lot with initial enrollment applications with the CMS 855A, where we have to refer that application along with our enrollment recommendation to a state agency or to various groups within CMS for final approval. That is one of the reasons that we're leveraging a different form. 855A does ask for a little bit more detail, which we'll talk about as we go through today, and some of that information needs to be approved, if you will, by CMS before we can go ahead and issue provider numbers in order to bill. Your submission options for the CMS 855A application are the same as they are with any other CMS 855 enrollment application. You have the option to submit them through the provider enrollment chain and ownership system, also known as PACOS, and you'll notice that I did provide a link to that system here. Or you can submit them through the paper template that's available on the cms.gov website, which is also a link that I've provided to you for that CMS 855A. Now, both of these application formats ask for the same information. The difference is with an electronically submitted application that comes to us through PACOS, it works a lot like various software. Maybe you're familiar with some of the do-it-yourself tax software, where it asks you a series of questions to identify what your reason for submittal is. And it's identifying what sections or what path it needs to take you down. So it takes some of the decision making out of it on the front end to ensure that you're filling out all of the appropriate information. The paper application is a little bit more do-it-yourself, where you have to read through information that's absolutely provided on that form to identify which sections need to be completed, whereas with PACOS, it kind of bolts those sections together for you, and it's just a little bit easier to navigate. The other advantage to PACOS is that processing times are much quicker. This is because we can leverage some automations, but also ingesting that application into our workload system is a lot quicker because we are bypassing the regular mail process. With the CMS 855A, it is an electronic template that you can fill out information. In fact, let me show you what that looks like. So this is the template that's on the CMS website. As I go through the sections, get to one that has just a little bit more information for you, you'll notice you can absolutely key information into this. However, you must then download, print it off, stick it in the mail it into our office, where it then has to go through our mailroom process, get scanned, and get ingested into our workload system in order for us to review and process that application. A paper template, that cannot be submitted any other way. Can't be faxed, can't be emailed. And we don't have automations built into PACOS for the paper application. We do have some automations of our own, but it still takes more time. There's just more manual work. So the processing time for a paper application is 30 calendar days, and the processing time for an electronic application is 15 calendar days. And I can tell you that, again, that's calendar days, so weekends and holidays count on that as far as processing time. So if you have not already started submitting applications electronically, I am going to encourage that you try to do that just to make your life a little bit easier, particularly when you get to the point of a revalidation, and we'll talk about that a little bit. So let's start walking through the sections of the CMS 855A. So for the CMS 855A, the first thing you have to decide is, what is this application intended to do? And it's going to look a little different between PACOS and the paper application, but both are asking you the same information. And when I say different, typically that means PACOS is asking for it in multiple questions, one at a time, to keep things simple and a little bit easier to understand. And sometimes it may ask you the questions in a slightly different order based on its system logic, but it is absolutely getting you to the same place as the paper application. So What's the reason for the application? Like I said, PACOS does it as a questionnaire. It's going to ask you what kind of provider you are. If you're looking at the image on the left, you'll see that institutional provider is going to be one of those options. And then it'll ask you, okay, are you not if you're an initial enrollment, but are you wanting to make changes? Or are you making a change of ownership? It will, based on the fact that you said you're an institutional provider, ask you subsequent questions to try to create the proper enrollment path for you. On the right, you're looking at the section in total where you manually have to check the sections in the first column. For instance, the first check mark here you see is you're a new enrollee. And then the next column is going to tell you what sections are required to be completed to accommodate that task. So PACOS is just a little bit more dynamic, and paper is just going to be a little bit more of a to-do list or a checklist, if you will, of make sure you complete these sections to execute what you're going to complete. Before I move into other sections, I do want to point out the most common submission reasons that we see. Initial enrollment is quite common. Revalidation is also very common. Revalidation is the process of re-verifying all of the information on your enrollment record. This occurs every 5 years for every enrollment record that we have in our PACO system. And it's really you fill it out very similarly to an initial enrollment because we have to confirm that everything we currently know is either still correct or account for the changes that have maybe had since the last time an application was submitted. The other very common application reason for CMS 855A is going to be a change of information. That works a little bit differently on PACOS versus paper. On paper, and we're going to get to in the next section, paper will ask you the type of change and then give you a list of those sections based on what you told it you wanted to change. In PACOS, it's going to identify as a change and it's going to allow you to go into all of the existing enrollment sections and make changes as needed. So it's just a matter of which route you're taking, but you can accomplish any and all changes, PACOS and paper. So section 1B, as I mentioned, is for what's changing. So on the left, you'll see where it's bringing you up to the topic section. And if you're ever filling out a change 855A, you're going to see check marks for completed in all of the sections. And that's because they were completed as part of the initial enrollment. But you still have full access to any of those sections. The links are highlighted in purple at the moment, but all of those are links that will take you into those sections. And I want to take a moment to point out, you'll notice next to those purple links is an addition sign with more information about and that topic. I encourage you, if you've been in PACOS and you haven't leveraged those before and you've had questions on what needs to happen in a particular topic, open those little help links. That's what those are. They talk about that section and what needs to be reported there. On the right, you're seeing the what's changing section, which actually encompasses 2 pages on the CMS 855A if it's paper. And you can change multiple things at a time. It's just listing the individual changes and here's the sections that need to be completed to execute that. The next section you'll get into is going to be section 2A, also known as the provider type in PACOS, but it's the identifying information. So here both formats are asking information about what type of provider you happen to be. So for instance, if you're a hospital, it'll be section 2A1. Those are all entities that are considered other than hospital. Whereas on PACOS, it's going to ask more specifics about the hospitals because you would have indicated you were a hospital before you got to this point. But on the paper, if you're a hospital, it needs to know subspecialties. If it's just a general hospital, you'll select that. However, these subspecialties are also known as subunits. So a hospital may have multiple subunits. You can identify multiple on one application. And one thing I want to make you aware of is depending on the type of subunit that is provided, it could result in multiple enrollment records or provider numbers for that entity. And that has a lot to do with how things are feed and how CMS sets up various um, various provider types. That's all determined as we review that application and we send it to CMS. I want to make it really clear that the MACs do not determine the PTAN, the effective date, or the number of PTANs to be assigned when processing a CMS 855A. MACs are reviewing the application for completeness and accuracy and ensuring that the provider is meeting all CMS regulations for the provider types they've identified on the form. If that happens, they are forwarding those initial enrollments on. With changes, this doesn't happen as much. It's more about just little confirmations. But with an initial PTAN assignment that is sent on, CMS or the state agencies will then communicate back to the MACs. This is going to be the provider's PTAN. We also call them certification control numbers on the A side, so CCNs. What's their number going to be? What's their effective date going to be? And do we need multiple? So and then we finish the enrollment based on that instruction. Section 2B is more identifying information, and here we're asking for things that are more typical. We talked about the 855B before. This is where the 855A and the 855B will align just a little bit. We're asking for things such as business information, legal business name. We're going to look for any other names or DBAs that the provider might have. What's their IRS designation? Are they a proprietary company or are they a nonprofit company? Those are the two that we see most often. Sometimes there's a disregarded entity, but that is typically a designation that we identify by the submission of an IRS Form 8832. And it's fairly rare on Part A applications. We typically see a lot of nonprofits and proprietaries. Then we'll also ask about their business structure. So are they a corporation? Are they a limited liability company? Are they a government or state agency? And it's going to ask them to indicate that they're federal or state, and then tell us what type of agency that they are. So if corporation, LLC, that doesn't fit, there are those other options. Section 2B is a fairly lengthy section, so we are continuing with 2B and also looking at 2C. It is multiple pages on the paper application and it is multiple questions inside PACOS. And the information that these sections are looking for are going to be any license or certification registration. So for a hospital, typically the providers are going to be licensed as a hospital in their state. That can vary. That's not 100% across the board. It depends upon those governing bodies where that hospital is located. But if they have a license, we're going to need to see it. We don't see a whole lot of certifications for these entities. We'll talk about accreditation a little bit later. That is something that we see more often on a CMS 855I. But if they're reporting that license information, we need the number, we need the effective date, and the state where it's issued. And this is something we are going to verify. The other thing that we ask for here is going to be the correspondence mailing address. This needs to be an address where we can reach the enrolling provider that was listed in the identifying information, so that legal business name. Where can we reach that enrolling provider? The caveats here, the things we see here, people often are concerned they can't have a P.O. box here. You can have a P.O. box, you can have a street address. What we see here is that we're being given addresses where we can't contact that enrolling provider, or we're getting billing agencies or medical management company addresses. And we cannot accept those here Billing agencies have their own section. And again, this section needs to be information where we can contact that enrolling provider. Section 2D and 2E, this is going to be medical record correspondence. This is not the same as the medical record storage address. When you're filling out an 855A, that can look like a little bit of a redundancy. They are actually two different questions. They may be the same address, and that is okay. So we're looking for medical records correspondence. If we need to send correspondence that was pertinent to medical records, where would we send it? It is also possible that this address is the same as the correspondence address we just spoke to. And to save you time, in the paper application, there's a check mark that says, hey, it's the same as that. In Pecos, it's going to give you an option as you're adding the address that it's the correspondence and the medical correspondence. So it's allowing for that same streamlined approach. You're also going to see accreditation here. And this accreditation is something that we do see. It is something that is not necessarily required when completing a CMS 855A. But what I can tell you is that oftentimes, if it is a provider application type or a provider, just a provider type that requires state agency involvement or CMS involvement, sometimes there is a certain survey site visit that is required. Now that's different from Medicare site visits. If a state agency requires a site visit, the accreditation can count towards that and sometimes speed up that process. So I encourage you, if you're enrolling an entity that has an accreditation, include it because it can actually help streamline your enrollment process. So you want to make sure that that's there. There's also a comment section here. This is really just for clarification. So if there's an unusual situation, maybe it's about the provider themselves, maybe it's about the practice location setup, what have you, you do have that section. It is available in Pecos as well. And this is just a free form section. You can accomplish the same thing by including just something on letterhead that's explaining any unusual scenarios. So certainly feel free to leverage that. G, this is where we start getting into sections that only if it's occurring. Now on Pecos, you are going to get asked if you are submitting your application for a change of ownership before you ever get to the topics sections. Whereas on a paper application, it is going to be in section 2G of the physical application. So this only needs to be completed if a change of ownership has actually occurred. Now, a change of ownership is not, say, a board member changed or one owner changed necessarily. So typically a CHOW is going to occur when a Medicare provider has been purchased or leased by another provider. But as part of that sale, what's going to happen is that the existing CCN or PTAN and provider agreement that the enrolling provider has with CMS is going to be assumed, but it will have a different tax ID number. It'll have a different legal business name. There will be a seller and a buyer. And typically there needs to be two applications. The buyer is essentially filling out an initial enrollment application. They're assuming the PTAN, but we need to gather all of the information because remember, we've completely changed the ownership here. The seller is typically sending in a termination 855A to let us know that they're leaving. And we identify both the seller and the buyer on CHOW applications so that we can link them to make sure. We won't process a change of ownership without knowing we have the seller and we have that term in-house. We want to make sure that everything's lined up, that transfers of ownership are all aligning as far as dates, okay? And That is partially because we cannot just change a tax ID in our PAYCO system. We do actually have to build a new enrollment ID in our system. So that is why it requires two. We have to turn off one enrollment and we have to establish a new enrollment, even though the new enrollment is going to have the same PTAN. We have to make sure that, again, everything is aligned so that we don't run into problems with billing. Now, there's a caveat to a change of ownership. If we have a scenario where one entity was purchased by the other, but the buyer is not assuming the provider's current agreement with CMS, then that's not technically a change of ownership. You can report it as such, it will be reviewed, but it likely will not be processed as a change of ownership. And that is because it's just a new tax ID. There's going to be a new agreement. There's going to be a new CCN in that case. We're not assuming anything. And then we will term that previous enrollment and CCN and provider agreement. If that scenario exists, as I said, you do have to fill out this section. PAYCOS asks the question on the front end because it's going to take you down the path of an initial enrollment, and it'll ask for the buyer and the seller information, but then it'll also take you down the path of a termination for the seller. So not always required. Section 2H is a slightly different scenario. This is for acquisitions and mergers. So this is when two entities become one, and the buyer is keeping their information and the seller is dissolved. So you essentially had two recognizable entities, two different tax IDs, two different legal business names, and instead of taking over, they're being absorbed into an existing provider that's not going to change. And sometimes that's typically going to result in the addition of locations to the buyer and not necessarily the creation of a CCN. It could require it, and that has a lot to do with the certain survey process, the type of provider, and CMS direction for that. But there are times where an acquisition merger really is just about terminating the seller and adding those new locations on that CMS 855A and then on the existing enrollment. Same thing here. This only gets completed if the acquisition or merger has happened. These are less common than changes of ownership. And I apologize for the screenshot that you're seeing for the paper application, but consolidations, that is another type of change of ownership that can occur. This is when you have two entities, both existing entities are going to be deactivated and dissolved, and a new entity is going to be created. So in that instance, you would have one initial application and you would have the two terms. But again, filling out that consolidation information is going to allow us to link those applications together so that we make sure that everything is aligned. So the next section that you're going to see is going to be the final adverse legal actions, and this is going to be for the enrolling provider. This is very similar to anything you see on any other CMS 855 application. In this case, the closest comparison would be that 855B, but we're asking about the entity being enrolled, whether or not they have any adverse legal actions, and you want to look at the section because it'll define the actions. First and foremost, we're looking for convictions, and we're looking for felonies in the last 10 years. Sometimes it can be for healthcare fraud, but it really does indicate the types of convictions we're looking for. There are some instances where, say, a healthcare fraud conviction that's a misdemeanor, that maybe still needs to be reported. Reporting an adverse legal action does not necessarily preclude the provider from enrolling in the Medicare program. It's something that gets looked at more closely up into and possibly referring to CMS for their guidance. MACs do have some guidance of what scenarios they can work through and which ones they need to engage CMS into as far as whether or not we will continue to enroll the provider. So here's what we need. Did an adverse legal action occur? Yes or no? If you say no, you're done. You move on. If you say yes, you do need to fill out some additional information, and in PACOS, an additional question is going to come up. So the things we're looking for: what was the action that was taken? There's room for multiple. If you have more than 3 on a paper app, you'll have to copy and complete that for any additional, but hopefully no more than 3. Then the date of that action and what action was taken. And these go on record as part of our fraud prevention program and monitoring. And again, it does not necessarily mean the provider will not be allowed to enroll. It's just that we need to have line of sight into what happened. If you're reporting an action, you do need to make sure that you're including court documents, and they need to be official court documents. So anything that you receive from those proceedings, not a letter from the authorized official just outlining what happened. That's not necessarily bad, but it on its own merit is not substantial enough. We do have to have the court documents. If the adverse legal action has come to a resolution, we want to see those resolution documents as well, especially if it's something that happened. We're hoping it doesn't preclude enrollment into the program. Make sure you include all of that information. If you answer yes and it's not there, we're going to ask for it. That's as simple as that. Moving on to section 4. We start out with practice location information. So practice location information is where you're going to report any location that needs to be reported under this provider type, this tax ID, this legal business name. If you're having subunits, you're going to report those here as well. So physical locations, we don't see this as much on Part A, but administrative locations for telehealth. If there is an ambulance that the facility is in control of, we're going to need any dispatch locations or any garage locations for those vehicles. And again, that's if that ambulance service is not distinct from that facility and is not going to be billing Part B for their services. So we want to make sure that that information is reported. This section is also going to ask for special payments information. And that's fairly specific to PACOS, and that is because you'll be asked every time you add a practice location for that special payments address. I do want to be clear though, per provider number per enrollment record in PACOS, or I shouldn't say provider number, it's going to be per enrollment record. They're only allowed one special payments address. So you want to make sure that you're reporting that appropriately. Section 4A does continue, and we get into Section 4B, and this is where, as I mentioned, you'll want to report any subgroups that need to be reported underneath this tax ID. Again, remembering they may get separate PTANs and separate enrollments. You will list what type of unit they are, and you'll see here there's a couple of columns. One is talking about the subunits that are hospital types. It's also asking about some location types on the left. So you want to make sure that you're looking at those and selecting the one that applies. Also, you'll notice on the paper application, it's also in PACOS when you select them. As you select from the drop-down, it'll provide more information, but there's CFR references that will provide the definition of those provider types or those location types. And then here's where on the paper application, you'll see that special payments address. Again, same information, just asking it in a slightly different order with paper versus an electronic PACOS application. Next is section 4C, and we're talking about medical records storage address. So this is not medical records correspondence, talked about that earlier. This is actually where the physical medical records are stored, if that's how they're being stored. We're going to need a street address, and that is a requirement because a PO box per CMS is not an acceptable address here. So that's one thing that we do see is we'll see PO boxes listed here, and we need a physical street address. Now, if the provider is leveraging electronic storage, which is very common these days, you are going to answer yes or no. And if you answer yes, we do need to know the service or the vendor for the software that's being used. We do not need a link or URL to the system. We just need to know, again, that vendor or that software that's being leveraged. For D&E or for mobile units, we don't see this a lot on 855A applications. This is much more typical on 855B applications, and it's typically ambulance services. But this is if you have any type of mobile unit as part of this enrollment, as part of this provider type, we need to have base of operations and vehicle information for all of the mobile units that'll be leveraged. And if reporting vehicle information, it does need to include the vehicle type, including the vehicle identification number, that VIN number that's, you'll see it scratched into different locations on the vehicle, or you'll see it in that windshield. That is, it'll also be on the registration document. So that is literally what we're looking for there. For F is a continuation, but here it's asking about the geographical location that those vehicles are serving. You can add geographical locations, delete them. You can report them initially. You can change them, though change is kind of loose terminology here because you really want to just be reporting them the first time, adding them, or deleting them to change. We really, especially in PACOS, even if that edit button is there, you don't want to edit over that existing information. To make changes to really anything in PACOS, particularly with regards to a location, you want to make sure that you're deleting it and providing it an end date and adding in the new information. Because of timely filing, the information you're removing likely needs to stay valid for a period of time. And if we just edit over it, we're going to lose that information from the file. Macs are aware of this. We're aware of that functionality in PACOS. So if we see something that's been edited, we are going to ask that it be submitted as a delete and an add to ensure that your file stays set up correctly to allow for proper payment. Moving on to the two ownership sections. Now, Section 5 and Section 6 are both ownership and managing control information, but they're for different entities. So Section 5 is for organizations that have ownership or managing control in the enrolling provider. So think parent companies, medical management companies, whatever the business structure may be. So we're looking for any direct owners, any indirect owners, any entities that have managing control, and we need to report all of them. We are also going to need their effective dates and their roles, and you can see this in both the PACOS and the paper side here, where there are multiple roles. This is a multi-page section, and you can select multiple roles at one time, and you need to provide the effective dates, the role that they fill, but we're also going to need percentages. This is probably the most developed. There's two things we develop for quite a bit here. One is legal name of the entity being listed. We need their legal business name. If they have a DBA, we want that as well, but we have to have that legal business name, and if we do not get it, we do have to develop for that. But then the percentages. So make sure that you're reporting those and reporting those correctly. It can get a little tricky with indirect owners because you have to calculate the percentage of ownership they have in the direct owner, and that kind of distills it down into how much ownership you have of the enrolling provider. The other piece is that If you're reporting entities here, we are going to be asking for an organizational diagram. That is something that was part of the flexibilities for the COVID-19 pandemic. That is not a flexibility that was extended. In fact, that came back before the COVID pandemic was lifted. So we do need an organizational diagram, and that's helping us chart those lines to make sure that we have everybody reported and we develop for any discrepancies or anything that might be missing. Section 5B, we ask for information about the type of organization. In addition to those percentages and those roles and those legal business names and dates, we need to know what type of organization is being reported in Section 5B. And you'll notice that if you haven't done this in a while, you'll notice they've actually expanded this list just a little bit, just to account for some of the things that we are absolutely seeing. But we're looking for IRS designation, business structure, and again, that type. 5C is for chain home office. This is if there is one, okay? Not all Part A entities are going to have a chain home office, so that is something to keep in mind here. This was previously Section 7 on the old version of the CMS 855A that they redid late last year. They consolidated this to make a little bit more sense. Typically, a chain home office is something that's going to be reported in 5. So they just listed it here. If you're not leveraging a chain home office, you won't have to fill out this section. If you are reporting a chain home office, the thing that we see missing is the chain home office number that was assigned. Those are all set. And we do need that information because that does cross-reference to our systems with CMS. Section 5D is the adverse legal action for the entity that is being reported. This is something we also see that we often develop for where we will receive multiple entities listed in Section 5, and we'll get separate sections for everything but 5D. 5D is not a section that can account for every entity being listed. We need a Section 5D for every entity being listed. So if you're listing 3 parent companies, we need 3 Section 5Ds, 1 for each parent company, not 1. If we only receive 1, we will develop for it. Same thing as Section 3 though. What was the action? What was the date of the action? Who took the action? And then any documentation specific to that action. Section 6A is for individuals. Now we're looking for very much the same information as we did with the organizations. This is just for the people that have ownership or managing control. So direct owners of the enrolling entity, indirect owners. This can get a little confusing. An indirect owner on an 855I, or excuse me, A, would be a direct owner of an entity listed in 6, or excuse me, in 5. So we're going to get the entities and then we're going to get the owners of those entities in 6. So you want to make sure that those are being reported. The managing control. So if you have business managers, you have board members, those do need to be reported. Roles. Providers can have multiple roles. And again, we need those percentages. Roles and percentages tend to be the item that is most developed for here. Section 6B is the adverse legal action, but again, it's for the individuals being listed in 6. Same thing here. If there are actions, you answer yes. We need some additional information on that adverse legal action along with documentation. If there aren't any adverse legal actions, you say no and we move on, but it does need to be completed for each individual being reported here. Section 8 is billing agency information. Only if you're leveraging one, if you have in-house billing and you're not using an outside agency, this is not a necessary section. But if you are reporting one, we need their legal business name. We need their tax identification number, including a social if it happens to be a private individual. We're going to need a street address, This is something also we'll often see PO boxes, and we actually need the street address here, and that is per CMS. So you want to make sure that's being provided. Section 10, this is a new section. This is for opioid treatment centers. And this is section 10A is for the treatment personnel. And so it's looking for any physicians or other eligible professionals that could include non-physicians, pharmacists, anyone with those prescribing rights uh, that are providing treatment. We need them listed here. Those are going to be listed on the record. Now, the changes were made on the paper application. They are not currently in PACOS. They will be implemented with PACOS 2.0, which I unfortunately do not have a go live for at this time. It's still in development, so stay tuned there. What happens though, you still can submit an 855A and report this information in PACOS. You would just need to upload a paper CMS 855A section. We will, if we receive an electronic application and we know we need this opioid information, we'll develop and we'll ask for the paper sections. We will not make you start over. So that's just something we're working around simply because we have a system limitation at this time. But hopefully that will be taken care of soon. Section 10B, very much the same, but we're looking for dispensing personnel. So again, we're looking depending on what category they fall into, but we need to know the personnel that are going to be interacting with those patients as either treatment or dispensing for an opioid center. And same thing, it's not available in PACO, so we would need that paper section uploaded. And the system is not going to make you aware that that section doesn't exist. It's just a change that CMS has chosen to hold off on until PACOS 2.0, but we have the workaround. Section 12 is for home health agencies. We don't see this a ton, but we are going to ask for the type of agency, the projected visits, and any financial documentation that's available, nursing registries, and this is also a new section and is also a section that will be implemented with PACOS 2.0. So just like the opioid section, this is something that we will need, the paper section, if you're reporting this through an electronic application. And with both of these, I don't want that to discourage you from submitting electronically. We have that workaround, as I said, but note that it's not an issue with PACOS in that it's not presenting it to you. It is simply a system limitation because it's not available there yet. Section 13 is contact person. This is a contact person for questions on the application. Please make sure that you're updating this information. One of the challenges we do have with this is email addresses not being accurate, or our email or CMS's email not getting through spam filters. So just make sure this is up to date. If we cannot reach out to the individuals in this section because we don't have a way to communicate with them electronically, we will be sending out a paper letter, and we try everything we can to avoid that because that does chew up the 30-day development time that's allowed. You can list multiple, but we cannot speak to anybody about the application that's not listed in this section. So if you know someone's going to be out of the office, consider adding a couple of people so that we have options. Otherwise, we will need changes to the application before we can speak to other individuals. And that is a privacy and security regulation from CMS. That's their directive to make sure that we're not speaking to individuals about any of the information on the app. As you can see, there's a lot of sensitive information on this application, and we're just making sure that we're connecting with the right individuals. Section 15, 15B is about authorized official. 15A is largely instruction, so we're not showing that here. But 15B is for the authorized official. Unlike the 855B application, they don't designate this by signing it. They are telling us they are that authorized official. They need to be somebody who is able to legally bind the organization into a contract. This application is considered a contract, so the individuals that can sign this would be, as an AO, would be an owner, a board member, a director or officer, a high-ranking official, and that person must be reported in 6. I said they can't designate the role of authorized official in 6, but they still need to report themselves in Section 6. This is also something that we often develop for. Someone will sign the application that's not reported in 6 or is not on the existing enrollment record if it is, say, a change of information. 15C is for the delegated official. The authorized official is going to delegate other officials to sign for changes. They can sign for reassignments on if you have someone who's doing a method 2 and they're filling out that 855A, or excuse me, I. They can sign for revalidations. They can sign for terminations. So typically, a delegated official can be an owner, a managing, all of the same individuals eligible to be authorized officials, but you could have W-2 managing employees also as delegated officials. We understand CMS and the MACs recognize that authorized official is busy and may not always be available. So this just gives another option. Billing staff that are directly employed could be eligible to be a delegated official if they are delegated by that authorized. Before I check in with Tom, I've just got a couple of more things. Documentation that you're going to see. Things we develop for IRS verification. We need federal IRS documentation confirming the tax ID and the legal business name that is on the application. If that is not provided or inaccurate, particularly with an initial application or any kind of, say, change of ownership, we are going to develop for that. License certification and accreditations, we try to verify all of that information through the primary source that issued that, but if we cannot, we will need to develop for it. I see this most often with license and accreditation, so providing that information, we try our best to get around you having to provide that, but providing it just kind of streamlines things. Organizational diagrams, we talked about that. If you're reporting any entity in Section 5, we do need that organizational diagram. If you have a change of ownership, we need to see a bill of sale, a stock transfer, or in the event of a consolidation, we need to see an agreement. That's just going to confirm information that's reported on the application. It also helps us identify if it's a true change of ownership, it's a merger or acquisition, or if it's a consolidation. Sometimes it's not clear when that application comes in. Maybe the person completing the form was unsure. This helps us solidify it. It's also information CMS is going to want to see. Additionally, CMS 588, which is an electronic funds transfer agreement. This is required for all initials. On revalidations and change applications, only if your bank account information is changing. Oftentimes we'll see this submitted with revalidations, but the bank information hasn't changed. Save yourself some effort. You do not need to send in that electronic funds transfer agreement if nothing has changed on a revalidation. By not submitting that, you're telling us the bank account information is the same, and we can bypass that. And on this slide, I'm just providing you with some resources that'll just provide a little bit more information on the 855A. There is a link to the template, but I'm also including some base information in the Program Integrity Manual, which is Chapter 10, that goes into a little bit more detail. And you'll notice there will be subsections when you go into 10.2.1 that'll actually include how to fill it out for specific specialties and provide some more information there. And then I also included the CFR specific to opioid treatment programs, just because that's a new section. That's our section 10. This helps define what those centers look like, what those programs look like, and the personnel that can be reported as either treatment or dispensing personnel. So with that, I'm going to check in with Tom. Tom, do we have any questions in the chat?
Yeah, we do have a couple. Let's go ahead and start with our first one. We're an FQHC when an 855A already in place. So they've already got the 855A in place. We're
Mhm.
adding another location. Do we need to do another 855A for the new location? I
You
think
will,
we need two Medicare billing numbers for each location.
yeah, and you will need to do a change 855A to report that new location. What'll happen with FQHCs, they do typically go through a certain survey process where we have to forward our recommendation, and we will then be instructed through that process whether or not an additional PTAN number is needed. And typically with FQHCs, you are correct. They're going to likely need that additional PTAN.
Next question. How long does the adverse legal action stay on the CMS record?
Really excellent question. So typically in that section, it typically outlines it, particularly with felonies, 10 years. Um, we have other mechanisms with which to check that background. So if there's something that's not reported that CMS wants us to get on that application, we will be able to see that. But typically it's 10 years, and that's specific to felonies. Those are the ones that we worry about the most.
Okay, thanks. Next, they're planning on having a mobile dentistry where we may see patients under Medicare Advantage plans. Even though traditional Medicare doesn't cover dental services, will we need to do a Medicare application for dental services for Medicare Advantage plans?
For Medicare Advantage plans, you'll actually have to contact those Advantage plans for their enrollment process. Traditional Medicare does not handle their enrollment process. If you anticipate that there is a need for that mobile dentistry scenario to bill traditional Medicare, you would need to enroll. That would not be an 855A though, that would be a CMS 855B.
Okay, next question. What is needed in the organizational diagram? The relationships are already disclosed in the application, so what additional information is being gleaned from the diagram?
Another fabulous question. So what we're looking for is really the connections. So the connections are in section 5. You are correct. But we are looking for full disclosure of all ownership so that we know that we have all of the direct and indirect connections reported. Oftentimes what we find is we're missing a connection. It's not always, but it's often on these apps simply because they didn't think the connection was strong enough. So when you have the entities listed and there's the connectors, it's usually a line connecting the dots, if you will. We're looking for those connections to that entity. Um, so it's really just confirming what is in section 5.
Okay. Back to the new location question. So we should first put in a change to our 855A and wait for WPS to tell us if we need a new additional 855A.
Um, Yes and no. So you're going to submit the change. Oftentimes what we find is if there's a change, we're just asking you to fill out a change. If through our certain survey process, it's identified that you need new PTAN, we often can leverage information that we already have because you're not necessarily going to know if that new PTAN is needed. So you're not a new enrollee, so we're not expecting you to send that in as an initial. So you might be asked for a couple of pieces, but you shouldn't be asked for a completely new 855A unless, say, you had a complete ownership change or the tax ID changed. We're going to be issuing a separate PTAN and we'll leverage information that we have. If the ownership is different, we'll need to know that.
Okay, that was our last question.
All right. So that's the end of our presentation today. On behalf of myself, Tom, and everyone on the WPS-GHA Provider Outreach and Education team, I'd like to thank you all very much for taking the time to attend today. I look forward to those comments because they are really important to us. They're going to help us drive our future educations and help us know if we're providing you with the information that you need. So please be sure to include any topics you'd like to see in the future as well. So again, thank you for attending. I hope you have a fabulous rest of your day. You may now disconnect.